Hello, everyone. My name is Antonio Montiel, and I'll be talking today about systemic lupus erythematosus. Excuse me if I can't pronounce that well, but I'll call it SLE just for the purpose of not saying it correctly. So let's go ahead and get started here. So a little bit about what SLE is. So it is a chronic autoimmune disorder in which the immune system attacks healthy tissues, leading to inflammation and damage in various organs. It is a complex and heterogeneous disease with a wide range of symptoms and clinical manifestations. A little bit about immunological disorders. These are conditions in which the immune system malfunctions and mistakenly attacks the body's own cells and tissues, specifically white blood cells. So these disorders are characterized by chronic inflammation and can affect multiple organs and systems. What the immune system is for, it plays a huge role in protecting the body against harmful pathogens and foreign substances. It consists of various components, including white blood cells, antibodies, and lymphoid organs. So, what is SLE? So, SLE can affect people in various ways. Okay, so some types of lupuses could be SLE, discoid lupus, drug-induced lupus. In addition to SLE, again, it can take various forms of it, right? So it primarily affects the skin and drug-induced lupus, which is caused by certain medication, and this is medications. This is discoid lupus. A couple of overviews of SLE as a chronic immune disease. So, SLE is characterized by the production of auto antibodies that target different parts of the body, such as skin, joints, kidneys, and hearts. It is a systemic disease, meaning it can affect multiple systems in the body. Epidemiology of SLE. So prevalence and incidence rates globally and regionally. So it is estimated that millions of people worldwide are affected by SLE, with higher rates reported in certain geographical areas. SLE predominantly affects women, particularly during their childbearing years. However, it can also occur in men and children in general. Certain racial and ethnic groups, such as African Americans and Hispanics, have a higher risk of developing SLE. The etiology and risk factors of SLE. So, hormonal factors, particularly estrogen, have been implicated in the development and progression of SLE. The disease often worsens during periods of hormonal fluctuations, such as pregnancy and menopause. Genetic factors also play a role in the development of SLE. Certain genes contribute to an increased susceptibility to the disease, although it is not solely determined by genetics. And then, what we talked about earlier is environmental or geographical factors, right? So, environmental factors such as exposure to sunlight, certain infections, certain medications, these can trigger the onset of SLE or cause disease flares in individuals who are genetically predisposed. SLE can affect multiple organs, including the skin, joints, kidneys, heart, lungs, and brain. The specific manifestations vary among individuals, leading to a wide range of symptoms and complications. In SLE, the immune system fails to recognize self-antigens and instead produces auto-antibodies that target healthy cells and tissues. This leads to chronic inflammation and tissue damage. What is the role of autoantibodies? So, such as anti-nuclear antibodies, or AMA, and anti-double-stranded DNA, also known as anti-dsnd DNA. Antibodies are characteristics of SLE. These antibodies contribute to the development of immune complexes that can deposit in various organs and trigger inflammation. Symptoms of SLE. So flare-ups and remission phases. So SLE is characterized by periods of disease activity. So these are your flare-ups. alternating with periods of reduced or no symptoms, remission. Flare-ups can be triggered by various factors, including stress, infections, and hormonal changes. SLE can affect various organ systems, leading to symptoms such as kidney inflammation, so lupus nephritis, pleuritis, which is inflammation of the lining of the lungs, pericarditis, which is the inflammation of the heart, and neurological manifestations. Common symptoms of SLE includes fatigue, joint pain, skin rashes such as the characteristic butterfly rash, fever, weight loss, and the disease can present differently in each individual. Diagnosing SLE. So imaging techniques such as chest x-rays or echocardiograms may be used to assess organ involvement in SLE. These tests can help evaluate the extent of damage and guide treatment decisions. Laboratory tests play a huge role as well in diagnosing SLE. These tests may include screening for anti-nuclear antibodies, or ANA, or those anti-dsDNase antibodies. And doing so, it assesses complement levels. Diagnosing SLE involves a combination of clinical evaluation and lab tests. And it's not just predisposed to the actual disease, but also post, right? To see that remission period, you need to see, endocrinologists if you have lupus nephritis, or cardiologists if you have lupus pericarditis. So it varies, right? It's not just during the time of having the condition, but also post-condition. So a diagnosis must be made for that specific criteria, including the presence of characteristic symptoms and the results of lab investigations while having the condition and during the remission period, like we spoke about earlier. So what are the types of complications that someone can have? Well, SLE can significantly impact a person's quality of life, leading to physical limitations, emotional distress, and social challenges. It is important to provide comprehensive support and care to individuals that are living with SLE. SLE can lead to various complications, including that kidney damage, cardiovascular diseases, infections, osteoporosis, and complications related to pregnancy. Early detection and appropriate management are crucial in preventing or minimizing these complications. Wrapping up here, we're going to talk a little bit about the treatment and management of SLE. So regular monitoring, follow-up with healthcare professionals is essential to managing SLE. This allows for the timely adjustment of treatment plans, monitoring of disease activity, screening for potential complications, and so on, right? Medications. So treatment of SLE involves a combination of medications, including anti-inflammatories, corticosteroids, immunosuppressants, and disease-modifying anti-rheumatic drugs, so DMARDs. Okay. These treatment plans are tailored to each individual's symptoms and disease of severity, right? So again, it's not just while you're taking it or while you have the condition, but even after it, doctors can still prescribe for you to be taking, medications, even if you're in the remission period. Also, lifestyle modifications, so sun protection, regular exercise, a balanced diet, stress management. These can all help manage symptoms and improve overall well-being in individuals. Some recent advances in treatment of SLE, personalized medications approaches, including identification of genetic markers and the use of biomarkers, are being currently explored to tailor treatment plans to individual patients. This holds for the potential for more effective and targeted therapies for SLE. Advances in biologic therapies have revolutionized as well for the treatment of SLE. Biologic agents such as belimumab, I don't know that one specifically, but what they do is specifically target components of the immune system involved in the pathogenesis of SLE, and again, offering new treatments options for those patients that have the conditions. All right, so patient education also plays a huge role in empowering individuals with SLE to actively participate in their own care. Increasing disease awareness among the general public and healthcare professionals is essential for early detection and timely management. There's also support groups. Counseling, mental health support are crucial for individuals with SLE that are coping with, various things that come about having the disease, and it can overall help the well-being and enhance resilience for the condition. Living with SLE also involves managing flare-ups and remission periods. This includes those prescribed medications, recognizing triggers, maintaining a healthy lifestyle, and seeking prompt medical attention if anything were to happen or to change. Right now, with the future direction in research for SLE, so it's important to detect it, right? So early detection and prompt initiation of appropriate treatment are crucial for improving the outcomes and preventing long-term complications. Research efforts are aimed at optimizing diagnostic strategies and developing interventions for early intervention. There's various aspects that are currently focused on the researching. I found this one here, the AMP-RA SLE program research. They have a specific phase or phases in which they are developing new therapies to target specific pathways and so on. In conclusion, right, SLE is a complex autoimmune disorder that affects multiple organs and systems in the body. It requires a comprehensive approach to diagnosis, treatment, and management. Advances in research and personalized medicine, offer hope for improved outcomes and quality of life for the individuals with SLE. Continued research, patient support, and disease awareness are essential in addressing the challenges associated with SLE and improving the lives of those affected. Just a kind of, wanted to talk through with that. I know someone dear to my family who unfortunately had lupus or has lupus currently, and specifically lupus nephritis, and they are definitely checking with the doctors every year. They're currently in the process of remission, but it's still an ongoing struggle, even though this individual does not have these flare-ups. But something to think about, something to really research. It definitely has hit home for me because I know this individual. I hope you enjoyed today's little lesson on SLE, and I hope you gained something from it. Thank you so much for listening, and have yourself a wonderful day.